10% increase over the last week, and over 3 million cases worldwide now, and also more than 55,000 deaths in the past week. All regions in the WHO system are indicating increased cases, in particular Mediterranean by 25%, Europe by 20%, African region by 50%, and Saudi region by 26%, sorry. The WHO in particular is indicating that the rise of the Delta variant, coupled with an increased numbers of persons who are no longer social distancing, countries are now relaxing, and these are creating a good environment for increased cases. Increasing social mixing, increasing mobility, along with suboptimal vaccination coverage is fueling this increase in new cases, in particular hospitalization and deaths as well. The Minister for Home Affairs prayed for one of our close sister islands recently that is experiencing some recent upsurge, and you can tell in that territory as well there's been an increased number of deaths based on the pandemic there. So in short, the WHO is saying, low vaccination rates, increased mobility, social mixing is increasing, and the new variant is creating the increase in the number of cases. In particular, in the UK, 99% of new cases is the Delta variant, and in the US, almost 60% is now the Delta variant. And of course, there's some more variants out there. One that's most recently identified in Peru, I think it's called the Theta, if I'm not mistaken, but some Delta variants, some other variants are now popping up as well. The Caribbean region continues to increase, a 3% increase over the previous week. And of course, you can see many countries in the Caribbean having clusters, community transmission, increased hospitalization, and deaths. Anguilla on the 15th and 18th of July recorded 2 new cases, one of a fully vaccinated female and one for a returning minor who returned from the UK, recently returned on the 12th of July. So as of the 18th of July, which was yesterday, Angola has recorded 113 cases, which 111 recoveries, 2 active. There are currently 14 persons in quarantine, and additional 71 other persons under surveillance. These are mostly minors who we require 4-day testing for. Since the 1st of July to current, up to yesterday, 4,238 persons have arrived via our seaports and airports. As of 11 a.m. this morning, 9,774 persons are registered to be vaccinated. Of that, 9,379 have had their first dose, representing 74% of the initial target of 12,600. And so far, 8,523 of those have had their second dose, which is 68% of the target. And if you look at the population total of 15,500, it's 60% having the first dose and 55% having the second dose, right? So we are moving up in the numbers. Just an explanation, I think a lot of persons have been asking this question about the last positive case in particular. We do 4-day tests of persons who come back, of minors, who come back from vaccinated homes abroad to vaccinated homes in Anguilla. We do a 4-day test for them. So that individual would have come in on the 12th, and we would have done the initial test on the 16th. Now, as you recall, as we mentioned in other press conferences, our testing equipment can pick up infections that might have been in the past. So when we did that initial test on the 16th, which would have been Friday, the CT values were very low. So it means it could have either been an early infection or a very old infection. So we do not report them when we have CT values very low. So those CT values would have been in the 30s on Friday. We normally do, the procedure is you do another test after 48 hours to detect if that is a new infection or an old infection. And when we did a test on Sunday, it would have indicated a new infection, because then the CT values dropped to the 16, down to the teens. So then is when we reported it was a new case, because if it were an old case, we don't report old cases from other countries. It wouldn't make sense to bump up our numbers when it's not our case. So the lag would have been because we do a test after 48 hours. So even though we did an initial test on Friday, which indicated the person was positive, the CT values were very low in the 30s. So it could have been either an old case or a new emerging case. And in the 30s, that person is not infectious. So when we did, but of course, we quarantined, that person was quarantined on Friday. And when we isolated on Friday, and the entire family quarantined. So when we did the other test yesterday, it was indicated a new case. That's when we reported it yesterday. So these procedures are in place to ensure that we do catch persons who come in. And certainly at this point in time, we're happy that we were able to pick up these persons on day 4, which, as you realize from times past, infections normally pop up in day 4 to 5. And that's when we do the tests. So that is the update to know, Premier.
Thank you very much. And we'll open up to questions from the floor.
Good afternoon. Mr. Rogers, you mentioned the statistics from the World Health Organization. You said they're reporting a rise in cases coupled with persons not social distancing because of the Delta variant. Do you find that persons here in Anguilla are a bit too relaxed as well?
Well, I think you have to look at the situation as it is. Each country has a different epidemiological situation. The current regulations and protocols we have in place in Anguilla are in place for a country that has basically imported cases, sporadic cases on persons coming in. We do not have local transmission at this time. We do not have community transmission at this time. So our protocols are a little different to a country that will have rampant community transmission. So you have to look at your protocols based on where you are at that point in time. We still have mask mandate in place for enclosed places where persons can't social distance. But I think all in all, Anguilla is being managed in a way that represents its current situation. If our situation were to change, of course, then we put new regulations and new protocols in place. But as human beings, as social beings, it's difficult for persons to remain locked up and restrained in a long period of time. And even constitutionally, we only put things in place when absolutely necessary. So I think in Anguilla in particular, people understand the dangers, people know the dangers what are out there, but based from a Ministry of Health standpoint, we put regulations and protocols in place depending on the situation at that point in
time. Over the past few months, we've been insisting on 15,000. We know that the island doesn't have 15,000. Is there something specific that we are saying because we're insisting on 15,000?
Yeah, the current estimate that we've had from population in Anguilla is between 14,009 and 15,005 persons on island currently. That is not a number you want vaccinated. That is the population of persons, the estimated. Of course, we haven't had a census since 2011, but the estimated population in Anguilla right now is between 14,009 and 15,005, right? And of course, based on that number, we look at our target population. So we do not expect to vaccinate 15,005 persons. We look at our population based on that.
Yeah, good afternoon. These figures don't always make quite sense. I personally know a lot of people who were vaccinated and have left the island. Now, is that coming into the...
Of course, we take that into consideration all the time.
You take that, yeah, okay.
The person who would have left the island would have been persons who will be resident for 3 to 6 months of the year, but we've taken that into consideration.
Okay.
As you will recall, the initial number that we wanted to vaccinate was 12,600. That was based on a population of 18,000 that would have taken into consideration people moving in and out. and so forth and so on. So we have taken these numbers into consideration. But that number in terms of the person who have left is not significant enough to impact the overall persons who are vaccinated.
The other question that a lot of people are asking, the lady who was tested positive when she was leaving, was that in her body all that time she was here? And then it came, it's hard to understand.
All right, well, let me put it in other terms. The lady, she tested negative before she came to Angola. She tested negative upon arrival in Angola, and she tested positive for tests going out. So it's quite possible that she could have gotten the infection on the way to Angola, right? But just there was not enough virus in her body when she arrived to test positive, because there's a certain threshold we look at for the machine to be able to take up, to test and to detect virus. So it's called a viral load, to be able to test the amount of virus in your body. So it's quite more than likely she would have gotten the infection on the way to Angola.
Mr. Rogers, we know that next week, the end of the month, the vaccine will expire. We know that the Ministry of Health has extended its operational hours. How many more doses do we currently have? And if they are not used up, how many will go to waste?
Very good question. Currently, we have close to about 3,000 doses left between now and the end of the month. The numbers that we have to vaccinate between now and the end of the month, we will have close to over 2,000 doses that we lose, quite frankly, that we won't need. However, we are currently working to see if we can donate those doses to a third country. When we do have more information on that, we'll be able to announce it. But at this point in time, we're still in negotiations, so we won't be able to announce that right now.
Were we able to use the full amount from Montserrat?
Most of them.
Most of them,
Yes. We were able to use the majority of them.
Okay. Dr. Webster, last week on Talk ANGUILLA, you made mention about the Pfizer vaccine, and government will look to procure this vaccine for the children. Any updates on that?
At this time, we're still looking into it, and we've discussed it with the governor's office and the foreign office, and so we are hoping that we can get there. I don't know if the permanent secretary has any further to add on that.
No, still in discussion.
Right.
You also mentioned last week as well that if the vaccination level is not up to at least 70% or more, government will have to look to implement policies. And while you said it's not mandatory, it will not be mandatory, could you tell us exactly what these policies will include, and has government made a decision as it regards to civil servants, especially those on the front line, in terms of being tested regularly?
I said it won't be mandatory where we force people to take the vaccine, but certainly the policies that we were discussing before, that those who have unavoidable contact with the public, that we may have to be more forceful in terms of making that required, because we do feel that it is necessary, and you can see in other islands, and France now is putting in very strict rules. We feel that it is the patriotic thing to protect those who are vulnerable, especially children, those who are pregnant, and those who can't take the vaccine for medical reasons. And it is unconscionable that we have to stay closed down or restricted because there are persons who refuse, who are defiant. I know there are some people who have concerns about their fear, but the thing is, we've had enough time now to see, 9,379 persons in Anguilla have had the first dose, and 8,523 had the second dose, and so far the side effect profile has been very, very, it's minimal. And so I think that we need to get to a point where we can get our people vaccinated, those who are eligible, so that we can move on and get coverage for the people of Anguilla. The health is paramount, and we want to make sure that we can take care of our people.
Dr. Webster, what about those who might be strong in their principle and refuse to take it? What is government's plan for those persons particularly?
And well, you did allude to that they would have to be tested on a regular basis and to make sure that, that they are not infected. Because, we don't want where persons are vulnerable to become infected and then transmit the virus. Because you can understand, if we think about the British Virgin Islands right now, the whole country is basically at a standstill because of the level of community spread that there is. Other islands have had similar, and so we want to protect this, the people of Anguilla as best we can. So there will, as I said, that's why I said last week that there are policies that we will have to revisit and come up with depending on how things are.
Just to go further into the question, we know in September school will reopen. You mentioned teachers last week not getting vaccinated. Are you not seeing the numbers up? What happens in that particular case for teachers who do not want to take the vaccine?
Well, the Minister for Home Affairs did mention that, those work permit holders would have to be vaccinated, including new. At the point in time, it was said that, public servants don't come under work permit rules, but these are things that we are discussing and have to discuss as we move forward. We certainly want to protect the children because they can't be vaccinated at this point in time, and as I said, we are working to discussing trying to get the Pfizer vaccine so we can make that a possibility.
If I can just add a bit to the Premier's statement, I think as the pandemic goes on further and further, the benefits of vaccination are just plain to see. It is obvious that vaccination is helping. The epidemic in the US right now is an epidemic of the unvaccinated, and it's being called that. The case, of course, you're going to have breakthrough cases in vaccinated persons. That's just the way it is. Nothing that man makes is 100%. But certainly, if something that man makes is 95%, it is very close to 100%. And certainly, the vaccination we have in the world right now, most of them are between 85 and 95% effective. So in the US in particular, it's an epidemic of the unvaccinated. And I've gotten some figures from my colleagues in some of our sister territories. And when you see what's happening, it is really, really, it comes to you forthrightly of what's happening with the unvaccinated. In the BVI in particular, at one point, out of the 41 persons who were in the hospital, not one was vaccinated. Now, vaccination, of course, you can get infected, but it's protecting against serious illness, hospitalization, and death. So when you hear persons say that you can still get the virus if you're vaccinated, yes, it's possible, but it's protecting against serious hospitalization and death. So if you look at the statistics in different countries, it is clear, absolutely clear that vaccination is helping. And if we were in Anguilla to get overrun by the virus, it creates not only economic hardships for us, but it creates also hardships in the health sector. And I'm referring to another piece of information I got from another colleague in the BVI. They have not only had to create field hospitals, but they have had to ask, and they sent out a notice on the 4th of July for persons with clinical background and nursing to apply to them because they need doctors and nurses urgently. I mean, can you imagine that happening to us here in Anguilla if we don't keep a good grip on it? And certainly, as some people are, I don't want to use the word cursing, but some people are criticizing us about our protocols. But we have to remain vigilant because we cannot allow this to happen. It's a small society, a small hospital. If we get 5 to 6 cases, 10 cases in our isolation ward, it is almost a catastrophe, because not only do we have to manage those 5, 6, 7 cases, but we also have to manage the hospital a long while using the same person. So it's a difficult situation, but we do understand it's difficult. The protocols are tough, but we have to keep our guard up because it is a difficult situation all over the world.
Dr. Webster, you said that the government's going to change their policy as far as the unvaccinated people are concerned. But you only have, it's the 19th of July, you don't have very long. When are you going to change this policy?
We've been appealing to people to get vaccinated. And certainly that is what we've been trying to do. We appeal, but at some point, the appealing has to stop, because if it's not working. So I won't tell you when right now at this moment, but certainly we are in discussions on this. And as you said, we are getting to the 31st of July when the current batch that we have expires. And we certainly would like for persons to come and get, if they haven't gotten their first dose yet, to come and get their first dose. The Foreign Commonwealth Development Office has said that if persons get their first dose, that then they would be guaranteeing that they can get the second dose even if it's past the 31st of July. So this is where we're at. Certainly you can understand that as we move forward, a lot of the activities will only be open to vaccinated persons, even for travel. We're seeing that already happening. And as we work on protocols to open up the ferry service from Blowing Point to Marigot, that is the consideration. So I would urge people to do it voluntarily.
In addition, the level of testing that they're doing right now as you enter Angola is simply not sustainable. I keep mentioning this every week because I want to get a message across. The level of testing we're doing right now is really not sustainable. We're trying our best to test everybody that come to Angola, and we're managing so far. But to run the economy as we need to properly, we need minimum people to come to Angola. And to get that level of testing done and turn around results in 12 hours, 24 hours is just not possible. So we need to get the vaccination numbers up so that even if a case or two were to come in, then we'll have enough vaccination in the country to ensure that it doesn't spread throughout the entire island.
I'm asking this question again for my Dominicano people in reference to the major vaccine that is taken in the Dominican Republic. We know that the Chinese, they produce 2 vaccines, and we are told that the UK, Health UK, does not recognize any of those. We know that WHO and the CDC have recognized the vaccines that were produced by the Chinese. We know that they are also working in the Dominican Republic and other places. When will we reach the stage in terms of recognizing that these vaccines work in other countries?
There's a difference between work and work. When you have a vaccine that has an efficacious level of 50%, it's a whole different ballgame to one that has 85, 90%, right? And certainly based on the size of our population right now, we will be taking our cues from our UK counterparts in terms of recognizing vaccines, because at the end of the day, we work very closely with them, and we've taken their advice for many, many months now, and it's worked extremely well. We are not, at this point in time, satisfied that the level of efficacy is, the risk that involves that in Angola is something that we are ready to take right now. We still will monitor the situation, but as explained before, because of the small size of the population and because of anything getting out rather quickly and can spread rather quickly. We saw what happened when we had the cluster. So we're gonna maintain right now the 4 main vaccines we have approved until we get some indication from our counterparts that we can change.
Thank you very much. Any other questions regarding the health team? If not, then I will allow the permanent secretary to leave, and he has some pressing business to take care of. We still want to let you know that our chief medical officer is still on leave, and Dr. Ward is doing a great job filling in for her, and we continue to keep things going in terms of monitoring the testing and approvals for those coming in. Certainly, it is a yeoman's task in itself, but we want to make sure that we decrease the chance of importing the virus as best as possible. So thank you. I'll ask the Minister for Infrastructure and Tourism to give a brief update, and then we'll ask the Inland Revenue team to come up here to the front so we can move right into their presentation.
Thank you very much, Premier, and it's going to be extremely, extremely brief. It's just related to the Carteret Boulevard and the Blowing Point Ferry Terminal. Work is already on its way. As you can see, over the weekend, ANGUILLA did a lot of work in terms of the planting of the poles to move the electricity further away from the road as we commence the mobilization for the start of the redevelopment of the Carteret Boulevard. We also recognize that there are a number of persons that has concerns over the large old tamarind trees that we have along the road, and we share those concerns, and we are doing everything that we can and having discussions as it relates to whether or not they can be incorporated, even though it'll come at a serious risk to motorists, or whether or not they can be transplanted. So we're exploring all avenues as it relates to those two roads. We've also solicited the help of our resident export horticulturalist, Mr. Lloyd Gums, who is very knowledgeable on these matters as it relates to whether or not it's possible to relocate those trees. And if it is, we would love to do so. Look at every possibility to ensure that the road is done while preserving those trees. We're also mobilizing for the new testing facility down at Blowing Point, so that persons that come to our shows can be tested promptly and thoroughly. Because the existing building where the testing facility is housed has to be demolished in preparation for the Blowing Point Ferry Terminal. So those are the two major things that we have, and I'm also pleased to state, and hopefully the Parliamentary Secretary can expound on this more. I hear the Premier speak to the Parliamentary Secretary, but in terms of tourism, I like to consider her the Minister of Tourism. But there have been some exciting things that have happened in tourism for the month of July. So that is all that I have today.
Just a very quick question. As it relates to the possible relocation of trees, what about those persons on the strip or vendors on the road? Where would they be? Where would they have to move? Is there a new location for them? How would they be impacted?
All of them have been given letters to indicate that they will have to be relocated. The process is that you go to a lands and survey to find the best available land in that particular area. Once that is done, they submit their designs to planning, and then they can do a lease or rent for that particular area during the time that the road is being constructed. I don't envision, after the road is done, that they can go back to where they were before, because the road will be widened in that particular area. It will encroach the area where from Willie's all the way over to the end of the road is at the moment. As a matter of fact, the tamarind tree that is close proximity to the runabout next to the James Ronald Webster's Park, that tamarind tree almost falls in the middle of the new road. So as you can appreciate, there are some challenges when it comes to the land and the possibilities of those vendors being there.
Wasn't there a plan for the vendors on the strip, for instance, for them to go some amount of feet back on the land, the Rastafarian?
Yeah, there is, but at the same time, the financial wherewithal to do so. The truth is that what would be a perfect situation is if it is that government can own the buildings and design the buildings, and then persons can rent those buildings from government, so that everything will be at a particular standard. Unfortunately, we don't have the wherewithal to do so. If government of Anguilla was a financial institution or business in the US, we'd be probably filing for Chapter 11 bankruptcy. So that is where we are. Hopefully we can turn the corner in 2022, but that is where we are at the moment.
One of the listeners to the last press conference, something for the tamarind-free by the Anglican Church so that you don't have to remove it. So we're getting suggestions.
Yes, as a matter of fact, I think I have.
This is Julio Carte.
I've had a plethora of suggestions over the weekend. You know, we have a lot of experts when it comes to this, and we've been receiving quite a lot of suggestions as how we can incorporate the tamarind trees in the overall design of the road, and we are absolutely looking at all of them with the hope that we can come to some sort of compromise.
All right, thank you very much. Any other questions for the minister? If not, you know, bring the mic. We're happy to have with us today the Controller of Inland Revenue, Mr. Lonnie Hobson, and the tax consultant, the Right Honourable Peter Harris. And I think that, you know, we will have them give us an update on the goods and service tax legislation. And I'll turn it over to you, Mr. Hobson.
Thank you, Premier. Good afternoon, everyone. As the Premier said, we are here just to give a brief overview of where we are today with the goods and services tax. Just a quick recap, we pretty much had the first reading back in March. Since then, we have been working along with the consultant, Mr. Peter Harris, along with the IMF, different stakeholders, holding some one-on-one with the taxpayers as well, and working along with Cabinet. Since then, we have come up with, and now we have a rate and a threshold available. And within this, we have some different exemptions that are also making a part of the GST bill. Right now, we're just awaiting finalization from the select committee of that report. And by next week, we will be taking the GST bill to the House on next Tuesday. Right now, there's just like I said, a quick overview. We are working on some material that we'll be putting out for education purposes. And as always, we have open doors, so you could come into the Inland Revenue if you need to get further information from there. So going right into it. So the goods and service tax is coming on the 1st of July, 2022. So that is the date set for it. And this may have been known, but if not known, right now we have the registration threshold, which is set at 300,000. And the rate selected now is the rate of 13%. Now, there are some sectors that must register, no matter what their turnover is. Pretty much in coming up with that rate and that threshold, everything was connected, meaning the gap that we have to fill to make up that 79 million. We had to look at exemptions that were given and the impact. All this impacted both the rate and the threshold that we finalize now. Pretty much the more exemptions that would have come into the bill, the more exemptions given would have mean a higher rate or a lower threshold or both. So a lot of time went into that to make sure that only specific key exemptions were given and taken into consideration. So exemptions from GST, just a quick overview here. Zero rate, as it says, zero rate, meaning there's no rate on those. That makes up basic foods. So some examples of basic foods, we have rice, bread, and flour. Also zero rated, we have commercial farming and fishing products. manufacturing products, the export of goods and services, and zero rated, we have domestic electricity, however, up to 130 kilowatts per month. So zero rated up to only 130 kilowatt hours per month. Zero rated, lastly, is the sanitary products and also contraceptives generally. And in the exempt side, we have healthcare, and in healthcare, this covers services and devices, health devices. We also have prescription drugs, education services and textbooks, insurance, both life, health, and international insurance, financial services, water consumption, so water from the Water Authority, sale of land is exempt, property sale of a second-hand home, property lease of 183 days and more, nursing homes or residential care services, religious services, personal effects of persons or nationals returning home. Now, these are to be detailed as well within the regulations, and this makes up the zero rate and exempt. And as I mentioned earlier, the exempt list was taken into consideration because we didn't want to overwhelm this list. Because again, the more things we were to put in exempt, then it could have affected both the rate and the threshold. And coming out of the committee and also in the public, we've been hearing a lot about the sales tax versus the GST. So I just decided to give a quick synopsis. We are going with the GST and the GST versus the sales tax. So sales tax, it would cover a large number of taxpayers. So meaning more taxpayers would have to be registered. And by doing so, it puts more strain on both those taxpayers as well as the Inland Revenue Department. Now, whereas the GST, as it's set out now with the 300,000 threshold, we anticipate 300 taxpayers. Additionally, in persons or taxpayers who choose to voluntarily register will also make up in that 300. But as it is now, 300 taxpayers based on the number set. Sales tax again, suppliers, they decide if customers should be charged the sales tax, and it only applies to the end user. But however, in the GST is charged on all transactions. So no decisions needed at that point. So it goes through and is charged at every stage. Another comparison again, the sales tax, more open to error and fraud, with the sales tax being charged on some, but not all supplies. So a person making a determination with whom or with what items to charge the sales tax on is lends to fraud. However, with the GST, all supplies taxed and invoices are used to recover the GST paid. So when persons file for the GST, they have to have that proof on hand and file those invoices along. Lastly, comparison, sales tax. Again, the sales tax is collected at the very end of the supply chain, so the debts are effect on the full sales tax. Whereas with the GST, it's collected at every stage. So every stage in the supply chain, and the debt affects that part of the supply chain only. So only at the stage of who's holding the goods and it's not passed on as yet, I haven't filed for the GST. So these are just some, probably many more, but I just try to take out and highlight a few at this stage. Now, our existing taxes versus GST, just a quick overview again. Our existing taxes, right now the interim goods tax, it is charged at between 5% and 9%, and that will be repealed. The GST is coming in, and that will now be at 13%, as stated. Accommodation tax, presently it is 12%. That would also be repealed. GST is coming on at, again, the 13%. Communication tax. Communication tax is currently 15%. And again, no, the GST is coming in at 13%. And we have the public entertainment levy that is on the books and charged at 10%. However, it was not properly administered, so we are repealing that. And the GST coming in at a 13% would make up for that public entertainment levy. And lastly, domestic services and goods. These are not currently taxed. So you will have some exempt items, 0 rated, and also GST on items that will be charged at 13%. Environmental tax, thank you, Premier. That is presently charged at 7%. However, we're getting it coming in at 0%. Remember, I mentioned on the electricity, where it's coming in 0 up to 130 kilowatt hours, and then thereafter, the 13% will kick in. Looking at sector impact, so specifically to sectors, the fishing, farming, and manufacturing sector, specifically, there's no GST on sales. However, the GST is recovered on purchases. Whereas in the tourism industry, there is GST on the sales, on stays, up to 182 days. So anything up to 182 days, then GST is charged on that. And also, GST is recovered. There's no GST if the stay is 183 days or more. And also with the service charge that you see on the bills from restaurants and hotel stays, there's no GST on service charge. In the retail and wholesale sectors, you will be charged, there's GST on the sales, most goods and services, they will be charged in the retail wholesale sector, and as well as GST is also recovered on those purchases for the GST registered businesses. For the property, again, there's no GST on land and second-hand homes, and the sale of homes, second-hand homes, and no, you're unable to recover in the GST on purchases. And if it is a new home or new commercial building, there will be GST on the sale of that property, and GST is also recovered on that sale of that home or commercial property. And in the service industry, on most services, the GST would be charged on the sales in most services, as well as able to recover the GST on those services where the GST is charged. So this one is new to us as far as the service industry. And also to keep in mind that for the property, there's no GST on any private sales that takes place, and as well as no unable to recover any GST in that sale as well. Now, the transitional, moving into GST, again, works have started before the GST, and they would also end after the GST is rolled out. The impact on this, we have provisions in place. These provisions have limitations, such as paying after the 1st of July for supplies made before the 1st of July, and is also limited to 3 months to get GST relief. So you have to ensure that GST is charged on the portion from July. So that means in persons who may have anything stock on hand or have any contracts in place and stuff like that. So for stock on hand, at the 1st of July 2022, provisions are being made to avoid double taxation on those stocks that you may have on hand, where IGT would have already previously been paid for the goods, and they are sold after the 1st of July. So we will have a transitional period. We will be coming out to the taxpayers to help them with inventory and how to treat that stock, and give some more further education on that as well. Now, for penalty remissions, yes, there are a couple penalties in the GST legislation, but we are taking this into consideration, speaking with Cabinet, and we would have to take this to EXCO to try to get some sort of leeway on initiating penalties immediately. Meaning that we want to work along with the taxpayers to help to educate them to avoid certain penalties or avoid falling into where we have to levy penalties. And before we do, we want to try to educate them and also reach out to them to correct any such. Now, the social impacts. I'm going to look at this in sector specific. Social impacts specifically in the health sector. There's no impact, meaning there's no GST charge on medical services or devices, and Cabinet were adamant on this, and we will make sure to protect these specific sectors. So the health, no GST is charged on life and health insurance, and no GST is recovered on the related costs. In education, there's no GST charge on services and material such as textbooks, as well as no recovery on the related costs in education. Electricity, we have one electricity supplier, that's ANGUILLA. For commercial customers, GST is charged on the bills. However, for domestic customers, there is no GST charge on the first 130 kilowatt hours per month, but thereafter, the GST is charged on 131 and above. And GST is recovered on related costs. So if you're in your business and you can recover the GST from the electricity from your business runnings. Now water, this is water specifically from the Water Corporation, metered water. There's no GST charge on both commercial or domestic metered supply water. So water, there's no impact to water at all. It's the metered water. And there's no GST recovered on related costs. In financials, there's no GST charge on most services in the financial services industry, as well as you're unable to recover any GST in these related costs. Now the price in the shops, we should only see an increase no more than the difference between the existing taxes that are being repealed and the existing taxes, as well as GST, and in some cases maybe even less than the difference of GST paid out by the supplier, which is recovered. So we shouldn't see no drastic changes in the stores when the GST is rolled out, and that's why we're going to ensure that we educate the store owners and perhaps how they're going about doing their pricing as well, because the difference should only be from the IGT now to the GST. Now, impact in business GST who have GST registered. The impact as a buyer. So as a buyer, you pay GST at import or to the supplier, and you're able to claim it back from the government. Now, as a seller, you charge GST to your customer, and that GST that you charge to your customer, you will pay it back to government. So that's how it will work, and how it will impact businesses that are GST registered. The impact on businesses that are not GST registered. Now, as a buyer, you pay GST at import or to the supplier, but you do not claim it back. So they're unable to claim it back if you're not GST registered. And as a seller, you do not charge GST to customers. So they're not GST registered, they should not be charging GST to any customers. The impact of GST to consumers, that's all of us. We buy from GST registered seller, you pay GST to the seller, and they pay it to the government. You buy from a non-GST registered seller, you do not pay GST to that seller. So only if it's a GST registered business, you would have to pay GST. And those businesses would also have to declare and have it displayed that they are GST registered. Now, some advice to taxpayers. To the taxpayers, it's not too, I hope you have been doing it. If you have been doing it, keep on doing it. We want to say to start keeping a record of your turnover. So at this point in time, you should be aware, and now that you know the threshold, you should have an idea that you are should be a GST registered business. So keep track of your daily sales as well as your invoice sales. If your turnover reach or is expected to reach 300,000 EC dollars per year, or you trade in a sector that must be registered, you must register for GST. If in doubt, contact the IRD, and we are here to assist you and give you direction on that. Again, no threshold applies for some. You must register if you're government, accommodations, suppliers, auctioneers, anyone in public entertainment, as well as promoters. So if you're any of the above, then you must register for GST, regardless of the threshold. Again, government, accommodation suppliers, auctioneers, public entertainment promoters, all must register for GST, regardless of the threshold. Imports. The difference between IGT and GST, with the interim good tax, you pay it at import, and right now, currently, there's no recovery. That is paid at customs, and that's where it stops. You cover IGT costs within your retail price. Now, with the GST, you pay GST at import, and you're able to recover that GST that was paid at import. You charge GST within the retail price, and that GST is then paid to the IRD. On bad debts. So the recovery of GST paid when you meet conditions, including you have written the bad debt off, so any write-offs that you may have, where you probably would have had credits given, those persons are not paying those credits. And we'll also have a full list of conditions available within the regulations as well. Now, if you issue credit notes where customer is GST registered, or if you repay the GST on any part of the debt paid to you. So you're able to recover GST paid when you meet these conditions. For business purchases, the GST recoverable. GST on purchases of goods and services relating to taxable activities, those are not exempt. For example, goods for resale, capital assets, any overheads, or any expenses. However, you have to also keep invoices as proof that these were incurred. For business purchases where GST is not recoverable, such as passenger vehicles, unless it's used for a hire, unless you hire it out. Entertainment, so you're unable to recover for any entertainment unless you're in that entertainment business or you're a promoter. Membership of clubs or any associations or anything similar to that effect, you're unable to recover GST. So non-business purchases, they are not recoverable. So to keep note of that. For GST returns, monthly declaration, you have to of the income, also of expenditure, and of tax. So you file and pay a return electronically. The system will be up and running come 1st of July 2022, and you're able to make your filings electronically. And you do this by the 20th of the following month of business. So 20th of every other month. As it relates to GST refunds, where GST on purchases is greater than the GST on sales, meaning regular payment to taxpayers, you're expected to take 6 months after due process. Whereas for regular repayment for taxpayers is expected to take about 2 months after due process. Now, due process simply involves waiting for subsequent payments that may be due, returns to be processed, as well as if we have any audits that were undertaken. So anything after that is expected for those payments, and that's with due process. Objections and appeals. There is a right for objections and appeals, and there are as well 3 levels of appeals. The first is an objection directly to IRD, and again, this objection is independent of the decision maker. So depend on any decision that may have been received. Someone independent will look at it. And from there, it must be made within 90 days of a decision based on whatever decision comes back. And then from there, if you're unsatisfied with that decision, you're able to appeal to the appeals tribunal. And again, this stage, within another 90 days, from there, you're able to, if not satisfied with that tribunal findings, able now to take it up to the last stage, which is to the High Court. And this is the last and final stage of the objections and appeal process. Dealing with interest and penalties. Now, there are a range of interest and penalties that exist within the legislation. There's interest for unpaid tax by the taxpayer, as well as unpaid refunds by the IRD. So any unpaid refunds by the IRD, they would attract 1% per month are part of. Now, in penalties, we have a range of penalties, a range of civil penalties. For example, a failure to register or failure to file, there are civil penalties for that. And a range of criminal penalties, such as obstructing of a tax officer or offenses by, as well, a tax officer. So it's a two-way street. It's not just going down one way, just the IRD, but as well as the IRD or tax officers offending a business or persons they're working with. For record-keeping purposes, this was mentioned as well, records are required to be kept for 7 years. Now, these are records of sales, records of purchases, any invoices raised and or received, bank statements. So right now, if businesses are commingling private and business, it's a good practice to separate out. And so if you don't want the IRD to be involved in any personal business, it's good to have a separate banking account for the business only, so that way you only have your bank information shared if that comes as a request. Also, any other accounting records used in the business. So however you keep your records, these are required to be kept for a total of 7 years. And they must be kept in the original format, including digital format, and also they must be produced in English. So if you do business in foreign countries, however the information is received, it should also be translated so that way it's noted in English for us to understand it. And lastly, in reference to support, as I mentioned, the IRD, we are here to support you. We're here to give advice if you need to understand if you should register, and just come, give us a call, come in, drop in, meet us. We're also going to guide you through the registration process, and we're here to help to transition into the GST, and transition including going through the repeal of the 5 taxes that were mentioned earlier, assisting you with dealing with your stock on hand when the GST is rolled out, and as well as any works in progress that you may have just before the GST is rolled out as well. We're here to support you, to facilitate any objections to decisions, as well as to confirm if your supplier should charge you GST or not. So consumers and taxpayers alike, we are here to help. And if you need to, you can always email us at gst@gov.ai, and our operating hours are 8 to 4, but we are open to the public internally from 8 a.m. to 3 p.m. However, appointments are recommended, but if you're in the area, you could stop in and talk to any taxpayers if you have any further information. Again, I thank you for listening, and as I mentioned, we are here to support you in this process because we're all in it together going forward. Thank you for your attention.
Thank you very much. That was fairly comprehensive. I just wanted to add to that we have tasked the Attorney General's chambers with, developing the consumer protection legislation, including price control, price gouging. These all we will be, once ready, the drafts will be sent out and then will be taken to Executive Council and to the House for passage. So, and the IRD will be doing the policing of the by checking stocks, prices, and things like that to make sure that we are not unduly passing on the GST when it is recoverable. Thank you. Are there any questions for the team?
Can I just ask, first of all, if this is your presentation is available online for us to see? Where can we get it?
Yes.
Sorry? You're going to send it. Okay. My second question, for the government, really. We had lots of discussions, protests, we had a committee, we had all kinds of suggestions came in and so on. Now, I personally, from the beginning, figured the bottom line was that we had to do it. But my question to the government is, did you consider any alternatives after all these things, or was all of that discussion just a facade?
Under different circumstances, I take offense, Brenda, but I know you mean well. We have, and you saw IRD did put up the comparing the sales tax with the GST. We certainly have taken the comments from the different public consultations under consideration. We listened to the 4 presentations that were made, and when you weigh the pros and cons of the different options, what we hear mostly as a criticism is that IRD is not ready for the GST and it's not culturally Anguillian. Well, the thing is that any tax is not going to be culturally Anguillian, right? And so, but there is, it does take a certain amount of revenue to meet the expenses, the expenditure, to provide the services that persons require: health, education, the police, maintenance of the buildings. I mean, these are services, medical treatment overseas, providing for the vulnerable, the elderly, and these are necessary things that government has to find the funding to provide. And so it's necessary to have that. There is a target that we have to make. Today, $79.4 million, as brought out when we do our projections in the medium-term economic and fiscal plan. And we certainly have to put in place the avenues where this can happen. Now, we could cut expenditure more, but we have basically taken it down to bare bones. We are back to 2019 levels in terms of recurrent expenditure. And we still know that with COVID, we have provided the unemployment and underemployment benefit, which would not have been catered for in 2019. We have had to improve the health system, double the size of the lab, bring in equipment. And even though we've gotten help from the United Kingdom government to do that, government of Anguilla still has responsibilities. We had to increase the subvention to provide health care. We had to give subventions to the Water Corporation. We had to make sure that we provide or that we can project that we can raise the funding to do the things necessary. We have a debt of at this point in time, almost $460 million that we have to service. And if you can't service your debt, you're considered to be a failed state. We have, basically unable to borrow without the permission of the United Kingdom government because we've exceeded our borrowing guidelines. We need the $20 million policy-based loan from the Caribbean Development Bank to make sure that we can continue to meet our obligations going forward. We are right now, as of June 30th, for what we projected in our budget for 2021, we're almost $30 million in deficit. And so these are the things that we as a government elected by the people to represent the people and look out for the well-being of the people have to make sure that we can provide. Because when the people are suffering, who they're going to turn to? It's to the government. And so that is why we know that it is necessary that the tax, we're trying to have a broad-based tax. We're repealing 5 of the taxes that are there. And I think the GST gives us that opportunity. Now, any tax we bring, as I said, is going to meet with, controversy. But I think we did listen to what was presented. And we have looked at technical studies that were done previous to us coming into government. And this is the one that I think will get us to the target that we need to get to, with the ability to provide the services that are necessary.
Good afternoon.
Thank you.
You finished? Okay. Hi. Mr. Hobson, I recognize you give the list of items that will be exempted, and even including electricity up to a certain level. But so obviously I didn't see gas on the list, so we'll be paying GST on gas at the pump.
In the short, yes. Yeah, that one did not.
Okay, Dr. Webster, I know at some point in time you were looking to charge the bulk suppliers, I think up to $750,000. Government was hoping to collect something of that sort. So I'm just wondering now with GST, and if you're still going that route, so I'm sure the bulk suppliers will be looking to collect on that amount. So they obviously will be looking to get that back, right? So it'll be a charge for us, and then on top of that, GST again. So it's almost like a double whammy for us.
Yeah, can I just speak to that a little bit? I understand that there is a bulk fee coming in, a bulk tax or something. GST will be charged on the pump price. So if the pump price has to be increased to cover the cost of the bulk levy, or whatever it's called, then there will be a GST element on that. And that's not uncommon. GST on petrol in particular is charged on top of any customs duties, any excise duties that are applied when they come in. So GST on top of these taxes is not unusual in my experience.
I understand what you're saying, but what I'm saying, for us, it will be more. That's all I'm saying.
Yes, I guess it will be. GST is a revenue raising reform. It's not a revenue neutral reform. It is meant to increase the revenue. So there will be an element of increase, but I guess there'll be some market forces driving it down as well.
Some folks want to know the difference between 0 rated and exempt. That's one.
Should we try and answer that? Okay. Okay, so 0 and in practical terms, if you are making a 0 rated supply, you can recover the GST. The idea of 0 rated is that it's still within the confines of a rate. It is a rate of tax, so the rate could change, but it's meant to make things more affordable, such as basic foods in this instance. Exempt, on the other hand, means that you're making an exempt supply. It's an essential service, and most essential services are provided for by the government. That's health and that's education. And they deny, whilst the customer gets the supply GST free, there is some hit on the supplier because any related costs are not recoverable on the GST front. So if GST was allowed to be recoverable on the exempt, it would be no different. It would be no different to the zero rated. And the country, what they say is the country can become bankrupt if all of its education and related costs on education and health are recoverable. So that's the difference between exempt and zero. But basically, if you make a zero-rated supply, you can claim the GST back on related costs. If you make an exempt supply, you can't.
You also made reference to companies or businesses registering. Isn't it going to be mandatory that all businesses register under the IR, Land Revenue Department?
Yes, it is mandatory once you're in the 300,000 threshold. However, if persons do not register, then we could also come out and also register them if we deem it fit that they should be registered and they did not register. So yes, and that's why I mentioned that they should take stock now of how much their earnings are, looking at their daily, weekly, monthly invoices to see if they're making up to the 300,000 threshold as well.
To the Premier, can more of the government operations go online in order to help reduce costs going forward, labor costs?
I think that is the plan, that we're trying to digitalize these things so that you can do all of that online, and that's one of the things we're working on with DITES to get that going. Yes.
You say that prices in the stores are not going to be increased, but I have heard several people with businesses saying that they're going to have to bring in an accountant to manage their invoices and their whole setup, their whole accountancy. And that leads me to something else. Supposing, there probably is an easy answer, but supposing I had a small grocery store, so don't pay GST. Felicia has a big grocery store, so pays GST. Aren't her prices going to be higher than mine?
Okay. All right. Sorry. Okay. I would have said they will increase, but they should not drastically increase the prices in the store, meaning the difference from the IGT, which is 9%, and the GST, which is coming at 13%. So we should probably see around a 4% thereabout difference in the price, right? But that's just not a clear-cut measurement either. But we shouldn't see a whole drastic change. Correct. Now, as far as the accountant is concerned, it's not a necessity to say you have to go out and get one, because right now the persons are doing this business as it is now. They are making the orders, they are keeping track of those orders, they are receiving those receipts. So it's just a matter of now taking on an extra leg of keeping things in order to when you get ready to file those returns online. So it's not a need per se to have an accountant in place. That's up to the business. If they feel that it's out of hand and they cannot handle it, then I believe they would now go to that route. But it's not saying that GST is forcing you down that road to have an accountant to do these things that are being done now as is in operation, how it is set up at the moment.
I think also to add to that question, Brenda, there are certain things right now where we are paying IGT on. With the introduction of GST, they will be zero rated. So, for example, there was a list that was produced earlier on what would be zero rated and what would be considered as basic goods. So your water, your bread, and basic consumption goods, we already pay taxes on those based on import taxes being incorporated in the price. But with GST and the items that we've chosen to incorporate in the zero rated list, those items will now be costed at 0%. So, for some things in the supermarket, the price will come down as a result of no taxes being applied to them at all. similar, no, that is what it will be. If it does not come down, and that's why the price control part comes in, it means that the merchants are not passing on the savings that they are getting from selling these certain goods. Similar to electricity, where everyone currently pays 7% regardless of their consumption. ANGUILLA was able to provide an average consumption across the island of 130 kilowatts. And what this does now is that where you ordinarily paid 7% regardless of your consumption, now if you're a domestic user, anything under 130 kilowatts and under will be zero rated, where previously you were paying 7%. So it is a matter of broadening the scale and also balancing the scale to protect those who may not be able to. So you will find in certain instances, certain prices may come up, and other instances, certain prices may come down. Similar to the communication levy, which was previously at 15%. With GST at 13%, it means that the cost and consumption for communication services will be reduced by 2%. So broadening will mean that in certain areas, it's about making it more equitable. So in certain areas, you will see a slight increase, and in other areas, you'll see a slight decrease. And especially for the basic goods and electricity, you'll see a drastic decrease because there will be no rates applied to certain parts of it.
And I think that the one thing too is, right now with IGT, that is paid the 9%. With the GST at 13%, businesses can claim back that 13%. So they shouldn't be passing on that to the consumer, because they'll be able to claim it back. So that's where the difference there.
And also, let me say, there was a question earlier about the difference between the small store and the big store. That it's not a given that the big store will be 13% higher priced because of the GST, because the small store will have had to import goods and will have had to pay GST at 13% at import, which they can't recover. So they're going to have to fold that into their price when they come to sell it. So the difference will be more marginal than perhaps you think. In terms of, just to touch upon the exemptions a little, it was mentioned just now about the electricity. Well, the Cabinet were very, very clear when they gave us a steer that they didn't want domestic users in particular to be charged anything more in GST than they were charged in environmental tax. And that's why we've created a figure of this 130, which means that the average consumption, which is deemed to be around about 300 per month for domestic users, packaged together, the up to 130 at 0 and above the 130 at 13% should come at about 7% in total, which is what they were paying, or which they are paying now. Similarly with water, they didn't want that to be any different, and so that's why water has been exempted from GST. The IMF, when they were doing the rate study and giving the advice, they were saying keep your exemptions really low for you to succeed. But the Cabinet were very clear that they wanted to give these benefits to the public and for economic growth as well, which is why manufacturing, which is why farming, fishing is now in the zero-rated schedule. So you've got a larger exemptions list than what I've seen in other countries that are developing and that are introducing the GST.
Just a quick question, Mr. Hobson. We know government's supposed to be collecting 79.4 million. Dr. Webster, you even could come in here. How quickly do you think you'll be able to make this money? You'll be able to get this? If it comes on stream July 1st, how quickly do you foresee?
Well, I mean, we need to make it in 2022, right? So that's the plan. That doesn't answer.
Well, obviously, quickly.
1 year.
I think a year. I don't think they should expect to get the 79.4 within half a year or 3/4 of a year. And just try and get it within that year.
That's it.
Any other questions? Anything online? Okay.
Excuse me, I did read something online that if they paid something at import at 13% GST, would they be able to recover the full 13% GST? Well, the short answer to that is yes, provided it's relating to a taxable supply that they are making. So, yes, that's the only question I saw.
Good. Well, I'd like to thank everyone. Thank Controller and, you know, Mr. Hobson, and thank you, Mr. Harris, for the enlightenment. Thank you all, the press, for being here and for the questions asked. Thank Dites for producing this, Lloyd for bringing it to the people. I want to thank, you know, the ministers who were here and participated, ministerial assistants, our liaison for the Spanish-speaking community, and also public relations officer. Again, you know, we want to thank you for being able to ask the questions that are important to the people of Anguilla and for bringing the information out. On Friday of this week, we plan to have the report of the Select Committee tabled in the House, and on Thursday of next week, the 29th of July, we intend to bring the goods and service tax legislation for second and third reading, along with the amendments which will include these technical parameters, the rate and threshold, and the exempted items. So this will be brought to the House on Thursday the 29th.